Welcome to Rehab Remix Reimagining Boundaries, the podcast that explores the future of orthopedic rehab within the construct of clinical innovation and connected health. I'm Rohit Nayak, co-founder of Band Connect, your host for this segment. Our goal is through these discussions to energize all of you to play a role in helping us address the many challenges that we all face in physical therapy, orthopedic rehab, and injury care, as we're going to be talking about at length today. Today, it's my privilege to introduce Brent Williams, CEO of Complete Care, a growing patient injury and rehab organization specializing in automobile and worksite injury care, offering a range of personalized and affordable care services for patients, or complete care, as I like to say. We'll be talking through a lot more of this through the conversation with Brent. Brent has a background in sports medicine, spent many years in medical device industry in various roles before transitioning to injury care. In addition to the many things we'll end up talking about, I want to give a shout out to Brent for his generous advisory support for Band Connect through the last few years. I, for one, didn't know what personal injury protection care for is, just as an example. And he was very patient and generous in helping me understand what that was and how that applied to Bad Connect. So with that, I'd like to introduce Brent. Brent, welcome to the show.
Thank you very much for having me. Looking forward to it.
Thanks for taking the time to be here. I think what I love to start with is a little bit about your personal journey and your background that brought you to where you are. As I just mentioned, I know you started in sports medicine, you were trained, and that was your undergraduate degree, I believe, in kinesiology. And at some point, you transitioned over to medical devices, a long, successful career. But I'm definitely curious as to how that transitioned over to what you are today at Complete Care.
So it's been definitely a bit of a convoluted journey. And I started out my undergrad, I was pre-med and thought, hey, I want to go the path of medical school, and actually thought of being either a cardiac surgeon or orthopedic surgeon. And the Mike Tyson quote, everybody has a plan until they get punched in the face. Had some situations come up to where now I'm having to completely fund my private college education while playing football, and decided that perhaps medical school wasn't going to be in the cards. So I was looking, okay, what's another pathway that I can engage in healthcare? And really enjoyed my experiences in the training room as far as watching the trainers. We had an amazing athletic trainer at Wheaton College, and just watching him engage with all the different players, the different athletes, and thought, this could be a good pathway. So changed my major to kinesiology, sports medicine, and went in that direction. So finish up my playing days at Wheaton and moved to South Florida, where I was going to then start an internship in physical therapy and go on. And this is right at the time when there was that transition to you needed a master's in physical therapy, and wasn't required yet, but that was the direction it was going. And so I thought I would then, continue on my educational career and get that master's and become a physical therapist. And again, getting punched in the face, the internship fell through, and I had to figure out what I was going to do to actually make money as a newlywed, 21 years old, freshly married. I need to work. So I actually took a job at a private school as a substitute teacher and coaching the JV football team and the freshman or the JV softball team with my brother-in-law. So that was the itch that I got to scratch a little bit from a sports standpoint, and worked as a trainer there at the school as well, and realized that very quickly teaching was not my zone of genius, or not where I wanted to spend my time. And so I ended up moving to Central Florida and getting a job working for a medical device company, bit of a startup, and I was selling laparoscopic equipment for laparoscopic gallbladder procedures. That was a big thing at the time. This was mid 90s, and laparoscopy was really starting to take off. And so that was my journey into medical device. And I spent a better part of 2 decades, more than 2 decades in that world, and working in sales roles, sales operations, marketing, and various national accounts roles, and really got to see that side of healthcare in a very intimate way. And one of the things that was hitting me over and over again is the individuals who are really most at risk, the health systems and the physicians, are the ones who are getting hurt when it comes to budget cuts, when it comes to Medicare cuts, and ultimately who gets hurt is it's the patients. And so I started to have more of this existential crisis coming up, like, what do I want to do? I love healthcare. What do I want to do? What direction do I want to go in? And at that time, I was having conversations with the owners of Complete Care, who I'd known since they started their own individual practices. And that discussion led to a part-time consulting gig with them and learning more about the company and really seeing what it is that they did and looking at the type of rehab models they were using for these patients who were injured in car accidents. And one of the things that there's a bit of a stigma around auto injury care. People think ambulance chasers, they think fraud, they think people who are just trying to game the system. And while there are elements of truth to all that, what's really there is you also have people who've truly been hurt, that have been neglected and perhaps even abused by the system and really need good care. And I saw that's what Complete Care had set out to do. And so that was really the impetus for me to go from the device world, great margins and really cushy job, to the provider world and the delivery of care and finding ways to deliver high quality care for a lower cost to operate, but also what can be a lower cost ultimately for the patient. So yeah, that's the very long-winded answer as far as from a journey standpoint, but what's gotten me to where I am now.
Yeah, we've been connected for more than 2 years. And I think I remember now your reference to pre-med, but I'd certainly lost sight of it. Yep. The twists and turns that our journeys take, right? So it keeps it interesting. But knowing you now as I do, I think one of the reasons we're having this conversation and we've been in touch for as long as we have is because you have an affinity for innovation. And through our engagement with your organization, you're also acutely sensitive and careful in terms of how you manage and run your organization. I've seen that as well. Tell me a little bit about your plans for complete care as you see that evolving over time.
Yeah, we have a vision for Complete Care. We call it Complete Care 2034, and this was launched last year. It's part of a 10-year vision of who we are. And first, understanding where we've come from. And we were founded by two chiropractors who had their own practices. They came together and they were doing your typical wellness-based care, and they started to do a little bit of work with auto injuries. And what that evolved to is let's have all of the services that a patient would need in order to accelerate their access to care and to improve outcomes because you actually have greater control over the patient journey when we can manage the diagnostic imaging, the advanced diagnostic imaging, the specialists, if there's an epidural injection or a radiofrequency neurotomy needing to be done for that patient, we can deliver the entirety of those services, but the core is always a rehab focus model and an active therapy model. So when we look at Complete Care 2034, it's taking what do we do really well and where else can we apply that? And so when we look at the opportunity growing from just a hand, when I started with the company 8 years ago, we had 9 clinics. We now have 31. We've seen a lot of growth throughout the Central Florida region, and we have plans to be statewide for another 75, 80 clinics around the state, and then branching into other states. So Complete Care 2034 is to be the leading musculoskeletal care platform in the United States, where we're impacting the lives of over 30 million Americans on an annual basis. So that's the big, hairy, audacious goal. And it's moving from just this injury care subset of patients to really the broader musculoskeletal needs. And it's really a focus on prevention and something that has been talked about in healthcare, but who's really executing on it? And I believe that we have an opportunity to do that with how we practice medicine and the scale that we're creating creates a beautiful opportunity to actually execute on this.
Wonderful. And and I've no doubt that you and your organization will get there. I don't think it's big and hairy for you, but I certainly appreciate how you look at things and how you systematically plan towards your next steps. One of the things we learned at Band Connect, and as you know, we've been in the rehab space for about 5 years now, but didn't have much experience in the space prior. And what keeps motivating us in terms of how we move forward is our ability to add objective data, to the rehab process that allows folks like you, your clinicians, and others to objectively look at patient care, look at patient progression with all the data that we can provide them with our tools and solutions. I know you have a lot of different initiatives in that realm. What is your general take on the lack of objective data in today's world?
The lack, I think, leads to patients either dropping off in care really early or continuing on when the effectiveness of care might be diminishing. And so having good objective data that can be leveraged first and foremost to establish a baseline. Where is this patient starting and what is the functional restoration we're trying to get to? Have we reached that point yet to where, okay, now we're on the tail end of that bell curve, and so there's a law of diminishing returns. And when we look at most rehab programs, there's a high focus on pain, and there's not as much focus on function. And that's where objective data really helps to get that focus back to function. Because when I can look at how well somebody has done using a device like Band Connect, where I can say, okay, there was this much force being applied through this range of motion on these exercises. And in by week 3 of the therapy program, we've increased that by 30, 40%. And now let's take this into a work comp setting where I'm trying to get this patient better so they can get back to work and move from being off duty to a light duty or from light duty back to full duty. And so, what are the objective measures that need to be achieved? And to be able to provide that, then it's a win for all because the patient is able to get back to work, the employer has that worker back and they're not having to pay out indemnity claims and paying for somebody else to do the job and probably not doing it as well as the person who knew how to do it. And so this is where everybody wins, and that's what objective data can do within healthcare. It's helping us to know when to deliver care, how much, and then when to stop. That's the other piece.
Correct. And we as patients, so I put myself in the patient category. I think, many of us are driven by looking at our progression, where do we want to go and where are we relative to where we want to be and how that motivates us to move forward. So really appreciate that you and organizations such as yourselves are going headfirst into this area, even working with people like ourselves, right? Which we're trying to do things in small ways, but hopefully impactful. I wanted to talk a little bit about value-based care, and there's not so much of it today, although very recently there was this CMS announcement of a program that starts next year. But what I really wanted to get into is that although there's very little traditional value-based care in the environment, you tend to operate in that same zone only because of programs such as the Personal Injury Protection Program or the mandate in Florida and other states. So maybe you can talk a little bit about that and where you see that going.
Yeah, well, that's actually a great tie-in to the vision of Complete Care 2034. And when looking at what do we do well and how can that be applied to other areas. So with the personal injury protection or what we call PIP here in Florida, every driver is required to have this $10,000 of coverage for their own medical costs, regardless of who is at fault. And so we essentially have a capitated model that we are working within. And we need to deliver as much care as we can for that finite pool of money, because there's many patients who have a high deductible health plan. And once they've exhausted those personal injury benefits, they may not be able to continue on in care. They may not be able to afford it. So how do we get them from ouch to ah as quickly as possible using those finite resources? Well, and that really is the essence of a value-based model. And if we were to take this and say, okay, how do we as an injury care group engage in value-based care? Well, when we look at the vast majority of the commercial insurance, people 65 to 70% of Americans are part of a self-insured or a self-funded corporate plan. And when you follow the money, who is really the one who will benefit from a value-based model? Well, it's the employee and the employer. And so we can take what we have done, and here's this comprehensive set of services, and now we can actually negotiate and partner with employers to deliver musculoskeletal care for their employees and to have prehab programs. We can actually talk about prevention, get people moving. One of the things that we've discovered on the injury care side, we've had patients who come in and after their accident, they say, I feel better now than I did before my accident. And it's because they're engaged in an active therapy plan. They're moving for the first time in a decade. They're actually starting to lose weight. They're seeing those markers of, their A1C starting to decrease. So type 2 diabetes can be reduced with movement. We know that within healthcare. But let's get people moving. What happens to other comorbidities? Hypertension, that can be reduced through movement. And so looking at how do we engage with an employer and their employees to deliver this type of prehab care, having movement programs that we can track and monitor using objective data to see where somebody is, and have some watch outs to then get that patient in and engage with them before something really bad can happen. That's where there's such a huge opportunity. And the health system as it's designed is still not ready for this. These beautiful buildings that hospital systems have built are meant for fee for service. It's not a value-based model. And so it's going to take organizations, I believe, like Complete Care, working directly with employers to say, let's carve out programs and let's deliver the care that your employees will need to prevent the need for the more expensive procedures down the road. Let's not just reduce the cost of a surgical procedure. Let's reduce the incidence, the need for it. What if we don't have to have 2/3 of the spinal fusions that we have going on right now? What would be the economic impact to the health system? What would be the quality of life impact for our population? This is such a fun time to be playing in this world in this way. And with technologies that have been developed, there's so much opportunity to engage with patients in a meaningful way that we couldn't have done 8, 10 years ago.
Yeah. It's fascinating to hear everything that you're talking about because it sort of gets to the point of holistic care. We talk about value-based care because we believe it's a stepping stone for moving away from transactional care, right? And moving into what one would call holistic care, looking at the complete self. I use the word complete again, and that certainly seems to be an area that you're looking at, embracing and executing on. So congratulations on all your efforts in that particular direction. This also leads to the confluence, if you will, between musculoskeletal care and primary care. I know you have specific opinions on this. Would you like to expand more on that?
The musculoskeletal care or physical therapy, let's just take that subset of musculoskeletal care, has always been essentially a lever for the orthopedic surgeon. So patient goes to their primary care, they have an issue with their back, they have an issue with their knee, their hip, etc. They're then sent to PT so that enough visits are conducted to now justify the referral to the orthopedic surgeon. And so that's where now it could lead to, you're going to have a hip replacement. Could be, oh, there needs to be a knee surgery. You got to deal with the meniscus. There could be something else going on. Well, the by engaging with the patient earlier and by working with the primary care to say, look, when you see the top 10 reasons for visits, you've got musculoskeletal related conditions that are all in the top 10. You've got neck pain, you've got back pain, you have headaches, which oftentimes are results of tension, and people who they've got a neck or a shoulder issue and it's causing the headaches as well. So if we can actually address these musculoskeletal conditions before they become chronic, or attack it early in the chronicity phase. If we can attack that early, then what happens downstream? It means that there's fewer visits to the primary care for these conditions. And so in a value-based world, the primary care physician is the quarterback, to use a football analogy. They are the ones or the captain of that ship. Musculoskeletal care is really that first officer, or it is it's again, using a football analogy, it's like the wildcat where you've got that running back now coming in, like, I can take this snap too. And we need to work hand in hand with the primary care because so many issues can actually be addressed by addressing the musculoskeletal needs of the patient. Getting patients moving, getting them active has such carryover effect throughout the rest of their body's health that if we can really partner in an effective way, the impact for the total health system will be massive. It's a huge, huge impact. $700 billion between lost work, between healthcare expenses. That's the musculoskeletal space. So what kind of impact can we have there? It's just huge what we can do.
Yeah. Yeah. I was amazed when I first learned about, overall healthcare spend on musculoskeletal related care. Yeah, it was fascinating and certainly motivating for us to continue to do what we're doing at various levels. One of the things that resonated between us, I believe, a few years ago and sort of helped us build this connection was one is, I think, your general orientation towards innovation. And I think one of the things that you probably saw with us was this whole orientation towards hybrid rehab. People have different definitions of hybrid rehab and how it's implemented. I'd love to get your version of that.
Yeah, the movement that really happened, I think, because of COVID, or it accelerated, and that was, hey, we can actually deliver care all through a smartphone now. And in a lot of ways, it's fantastic that we can do that. However, when we lose the human touch, that lack of connection just creates more opportunity for disconnection, where it's easier for a patient to fall off. And while there's organizations that are very entrenched in this model of totally remote or totally off-site, they say, hey, our retention is good. That's not necessarily proven out long term. And so what I love about a hybrid model is you're combining high tech and high touch. To be able to have a patient coming into a clinic and to look the chiropractic assistant, the chiropractor, the PT, the PTA, to look them in the eye, to share, here's what's going on, to be able to have that direct interface, it is very different than doing it through a screen. And so if I can have this hybrid model where a patient can do their home therapy and I'm getting objective data from it to see what is actually going on there, whether it be a video recording, there's range of motion tracking, whatever those metrics are. When I have that, I can take that in the clinic and go over and say, hey, we need to change some exercises up for you. Or why don't you show me how you're doing this? And like, we might need to modify some things. And so it to me, that hybrid model allows, in a value-based model, it actually can allow me to treat more patients effectively with the equivalent of a one-on-one care because it is taking their specific data, not just observation in a group therapy setting. it's taking their objective data, and now I can customize my plan to what they actually customize their plan to what they actually need. And so that's what I absolutely love about the hybrid of the high tech and high touch.
Yep. When we work with clinicians, and we're seeing some of this happen as we continue our deployments, work with new clinics, and there's movement there, right? So first, when we started with hybrid, there was a general inclination to say, oh, that means reduced visits. So in a fee-for-service model, in a transactional model, that's perceived as a negative. I think over time, people have begun to appreciate exactly what you just said, which is there's a way to optimize the frequency of visit that is positive for both the clinic as well as for the patient in terms of the progression towards the desirable outcome, which was what we all want. And we've spent a fair amount of time trying to figure out how to establish our value proposition within a fee for service structure. But it's conversations like this and with folks like you that have really helped direct us in staying the course behind what I believe we're providing here. A couple of quick questions. As you look forward and the world that you're working in, what are some trends that excite you? You can start with rehab, but you can go broader too. So,
So, one of the trends is actually a greater focus or perhaps a renewed focus on prevention and looking at prehab is a term that we like to talk about.
yep.
And a shout out to the book that Peter Attia wrote, Outlive, that he really gets into like what are the conditions that cost this in the health system so much money and how could they be avoided by essentially preventative type of care. And so this trend of prevention and starting to actually address needs before they become a big issue. That is something I'm really excited about and see a tremendous potential. And looking at it, a large employer where it when they have a softball league or a kickball league that they're doing with their employees, getting people out and engaged and moving, that actually is a form of prehab. It's like, hey, let's get you active. Let's encourage this activity. Helps to reduce stress. It helps to shed weight in certain cases. There's an opportunity for people to now get into their body and to feel that movement, to experience being outdoors, and the carry-on effects of that are significant from a long-term health standpoint. And so this trend that is coming to fruition more and more of let's engage early, let's focus, let's put our resources on early detection. Let's put our resources on the prevention. If we were to spend as an employer, we have a self-funded plan for our employees here. If I put resources into a gym membership, say, then I can actually track who has that membership, who's leveraging it, and to be able to intervene. We can also have programs say, hey, here is a training program based upon what your goals are, and we can help to do that. And if it means we're funding $25 a month for our employees, but it saves me 150, 200, $300,000 in my healthcare spend in a year, 2 years, that is very much an investment worth making. And so these are things that employers are starting to look at as well. And this happened in the work comp space of, hey, we need to do pre-employment physicals. We need to make sure that this person is actually healthy to carry out the duties of the job, but also work hardening. Hey, there's repetitive strain. We might need to change our processes up. Let's change how we're doing things so we're not creating an injury down the road. And now you carry what was learned there into just the general healthcare model, and what a great opportunity. So that is the biggest trend that has me most excited. And the other is when we look at what AI can do, and there's a lot of buzz about it. And I think 90+% of it is yet to be proven as helpful. However, when we see what's been able to be done with having bots that handle repetitive tasks we're reducing some of the computer strain, if you will, that employees have had to have. And we're actually creating opportunities for people to engage in one-on-one conversations again. And that desire for that engagement is perfect in the healthcare model. It says, we need to engage with you. We need to have a relationship with you so that you will want to continue on this prehab program or this long-term cradle to grave musculoskeletal care program for you that has been designed specifically for your needs. And so, freeing up time to have greater connection just opens the door for that. So we're at a really, really cool inflection point, I think, as a society here in the United States, but also globally, there's a lot happening that is opening up this space for people to think more about their health. And if I make a change right now in my 20s, it's going to impact me in my 30s, my 40s, my 50s.
Yep, I was going to ask you about the AI piece, but I'll get back to that in a second. Thanks for jumping into that. One quick comment. I just love the way that you talked about what you're doing internally within your own organization and your employees in a perfect crucible for you to experience, right, within your own teams, what is going to work for your customers, your employers that you're targeting as well. So I think that's a brilliant way to look at it. One of the things about AI that bothers me, and that's really my next question here, is what is the trend that bothers you, right? I've seen a fair amount of technology folks primarily who under the sort of the word disruption are talking about how AI and technologies are going to replace clinicians or automate clinicians. I love the way that you said you're talking about repetitive tasks and so on and so forth. But what are your general thoughts? My belief is that there's a good hybrid way that we can leverage technology to make clinicians more effective, more not, more engaging in terms of what they do. And I believe that's what we're focused on at Band Connect. Would love to get your thoughts on that too.
I see I see AI playing a role in healthcare that one can actually speed up diagnoses. If I were going into medical school and then having my internship and choosing my residency program, I would not want to be a reading radiologist. I see there's an opportunity there where, because of the billions of scans that have been done and the training that can actually occur, where an MRI, a CT can actually be read via AI. I don't think we're too
Yeah,
far off from being able to
yeah.
have that. And so that's where, could there be replacement? Yeah. Is there going to be replacement for somebody delivering hands-on care for a surgical procedure? You know, I don't know of a surgical robot yet that doesn't require, it's basically an extension of the surgeon. It is not doing the procedure for the surgeon. So there's areas that I think we're going to be a ways off before we see anything there. But again, going back to the diagnosis piece, to where there's, as a human, I have my own biases. So when I'm looking at information, everything that I have learned, been taught, observed is informing this decision, and it is limited to what I've been able to retain. With an AI model that can retain the breadth of a million physicians and their experiences and observations, and now having the notes of this patient reviewed to say, hey, here's what they're experiencing, what are the different possibilities, I think can actually speed up some detection of things that are going on. Also, to find what are these watchouts? Like, hey, this level, from a blood work standpoint, this level is going up a little bit. Here's how can intervention can occur right now. And so I see that that's where we can have our own, concierge type of primary care in our pocket, where looking at, here's things that we're eating, here's our sleep habits, here's what's going on. Hey, little watch out here. Maybe not play so hard on the weekend, as far as maybe, just 2 glasses of wine and, not 3 bottles. There's going to be that nudge to be healthier perhaps. And so that's where AI can really be an amazing tool. One of the fears with that, though, is I look at what happened with GPS. We used to get paper maps when I was a sales rep. I was living in Southern California. I had my big book of maps, and it had each zone of Southern California. I'd flip through the pages and mark things up to know which hospital I was going to and which doctor's offices were there. Got very good at reading it. But then with GPS, all of a sudden, I can't figure out my own way home from my office that I go to every day because I just punch in GPS and it's telling me which way to go. So if I'm relying on AI to do everything for me, my concern is that I lose my ability to think for myself and to have critical thinking, to question, and to develop this sense of a bit of cynicism of, is that really true? And so that is a fear, perhaps an irrational fear, of where things can go, that it causes us to be dumbed down as a society versus really being critical thinkers and using it as a powerful tool to explore more and in different areas. It's the double-edged sword that's
Fantastic.
there.
Very well said. I think you covered both sides of it beautifully. And I agree. I agree. I remember the time, and this was years ago when I was using a Garmin GPS. Some of us remembered that you have arrived, right? Except that I was in the middle of nowhere when it told me that. And I said, what do I do now?
Yeah,
Well
getting taken
said.
on a back logging road in central Georgia, trying to get to an in-laws lake house, and yeah, this is Clay, and we're in a minivan. This is not going to end well. And so that was my experience where I no longer trusted anything that
Yeah.
was being generated by that map.
Yeah. And your point is well taken. So applying that to healthcare diagnoses, we want proper consideration and knowledge base to continue in the direction without 100% reliance on what technology is telling us. So well said, well said. So we're almost at time here. It's amazing how time flies. So last question. The as much as musculoskeletal care is growing in importance and need, the industry that is delivering that care is under some pressures from a reimbursement standpoint, all the different things that we talked about earlier. You've, though, managed to, leverage certain pockets and areas and focal areas for you to thrive as an organization. You're a growing organization. You have a big, hairy, audacious goal for the next decade or so. So, what's one piece of advice that you would give your peers or others in your industry, to keep the positive outlook and the direction going the way that it should be?
I go back to the concept of following the money. Like, where is money being spent in healthcare? But who is the one spending it? And when we look at commercial health insurance, 65 to 70% of the insured population is under a self-funded plan. And so that's where the direct to employer type of relationships are really going to be critical. And, physical therapy has been under siege for a very long time. The fact that now it requires a DPT, and, the amount of schooling needed, and then reimbursements being cut to where a visit, regardless of what modalities are delivered, regardless of how much hands-on therapy, where you've got major insurers paying 60, $65 maximum for a visit, the economics just don't work out. You can go to a massage therapist and pay cash for a massage, and it's going to be double what that physical therapist who has a doctorate is going to get for that. And so I think value-based care can actually be the savior for the physical medicine world, because by directly contracting, saying, hey, we're going to keep your people healthy. And then when there is intervention, we have all these modalities where we can combine technology as the high tech, high touch. We can combine this to deliver high quality care in a very cost effective manner, that the money that would be going to an insurance company can actually just be paid directly to the providers. And so there's a tremendous opportunity there. And then demonstrating through data, we're reducing the incidences of surgery. We're reducing the incidence of these long-term chronic conditions. And that reduces the overall cost of care. in the long run. And so that I think is, part of the big, hairy, audacious goal is that every self-funded insurance plan in this country has direct contracted relationships with physical medicine groups, with musculoskeletal groups, in a per member per month type of environment that says we're paying you to keep our employees and their families moving and healthy, and you're partnering with the primary care to do it. That to me is the big, hairy, audacious goal. And from an economic standpoint, that's where there is so much opportunity. Because if you were to take 10% of what is being spent on surgeries and you were to put that into physical medicine, as far as the prehab rehab model, we wouldn't have the reimbursement issues that we have for physical therapists. We wouldn't have people who are under such stress because of loan payments that they can't afford to start their own practice and they're having to work for a larger corporation. So there's so much potential within that. And that's where that's what I get excited about, wake up every morning, like how do we continue to approach this? How do we meet this need and what can we do? It's just really exciting time.
On that positive and uplifting note, I'd like to bring our discussion here to a close. Thank you, Brent. Thank you for engaging in this discussion and for sharing all those nuggets. That was fantastic and certainly eye-opening for many of us in our various interactions with you. You've been listening to Rehab Remix Reimagining Boundaries, produced by Band Connect. I'm Rohit Nayak, inviting you to join us next time as we continue our journey together in what we'd like to call our hybrid rehab revolution. Please follow us and subscribe to our Band Connect channel. Thanks, Brent.
Thank you.